As the Omicron surge continues, data shows many patients aren't in a rush to get their kids vaccinated against the coronavirus.
Sabrina Wilson has more on why that concerns doctors.
Kids aren't immune to COVID-19 infection, but vaccination rates for those 5 to 11 years old are lagging.
I think the perception has been that COVID is not dangerous for young children. And while most children who become infected with the virus do recover uneventfully and have relatively mild disease, not all of them do. Some are severely ill and a few die.
Vaccinations are critical, says Dr. Mark Kline, physician-in-chief at Children's Hospital New Orleans. But Kaiser Health News analyzed vaccination data from the CDC and says as the Omicron variant surges, COVID vaccinations for young children stalled. According to this KHN map in Louisiana, just 4.8% of kids 5 to 11 are fully vaccinated and 10.9% have had at least one dose, something Dr. Kline calls disappointing.
This vaccine is safe and effective for children 5 years of age and up. There was a flurry of activity after the Food and Drug Administration gave emergency use authorization in early November. And then it just slowed to a trickle, and there does not seem to be very much interest.
Neighboring Mississippi isn't much better. KHN's map shows a fully vaccinated rate there of 5.1% and 9.6% of 5 to 11-year-olds having one dose. Nationwide, COVID is hospitalizing kids by the thousands daily, and some are in ICU.
It's not just the children who have underlying medical problems. So that's what's scary.
At Children's Hospital New Orleans,
We have 15 patients in the hospital today with a diagnosis of COVID. That's down from a peak of 28 last week. So I'm feeling cautiously optimistic that maybe the worst of this is behind us. We'll know more over the next few days, I think.
and given the low vaccination rates, Dr. Kline believes parents who were eager to get their kids vaccinated have already done so.
Yes, I think that the parents who were enthusiastic about having their children vaccinated have done so.
And skepticism is present for others.
When I talk to parents, I hear them say that they're worried that the vaccine was developed very quickly. Maybe it wasn't tested adequately in children. Maybe some corners were cut in its development. That's not the case. It went through a very rigorous process of review and approval. And I'm personally convinced that the vaccine is safe and effective.
As a highly contagious variant continues to swirl, I'm Sabrina Wilson, Fox 8 Local First.
Dr. Kline says parents of kids too young to be vaccinated should surround themselves with vaccinated people.